And then we'll follow up with him and see how he's doing after 5 days of consecutive treatments. All right. Yeah, that was a loud one. Yeah. All right, lay on your stomach. Okay, here we are, day 5 here with Parker, and we found the pelvis is a little bit out of alignment, so we're going to correct that. But he's certainly doing much better with that costochondritis flare-up he had. Relax here. Good, and the other side up. So since you guys have all seen it before, we lasered his upper to mid-back where the rib heads meet the spine, and we're going to laser the chest, the pec muscle here in just a minute. And then we'll follow up with him and see how he's doing after 5 days of consecutive treatments. All right. Yeah, that was a loud one. Yeah. All right, lay on your stomach. Okay, go ahead, take a deep breath in. Good, and again, deep breath in. And blow all the way out. Okay, turn over on your back. We're gonna sandwich with 2 lasers here. So we're gonna do both sides here. Obviously it's your left side that's worse, so we'll focus on that. Now, today might be his last day, so I am going to up the ante, meaning we're going to go deeper with the laser. It's unfortunate we don't have, another week or so with him, but it is what it is. All right, so you're not going to feel any different here. It's just penetrating deeper into the tissue and helping with anti-inflammation, just deeper though. So this will penetrate anywhere from 2 to 5 centimeters, whereas the other frequency I was using 1 centimeter. Huh. And this is it, folks. So it's not that exciting, but I will tell you the laser is a game changer. So if you have had or done the stretches that I've done some videos on costochondritis stretches. I've done 2 specific ones, one with 22 exercises and stretches and the other one with 3 of my favorite. If you've done those consistently over the course of 4 to 6 weeks and things have improved but they haven't improved completely, then I would recommend seeing a chiropractor, not a physical therapist specifically, because the PT can't manipulate the thoracic spine and the ribs. Some may do that, but most don't. So doing the stretches and exercises, or having a PT, physical therapist, do the stretches and exercises while you're doing some chiropractic thoracic mobility exercises and manipulations. If after consistent at least 2 to 3 times a week over 4 to 8 weeks, if you're not seeing any improvement or resolution of your costochondritis symptoms, then laser would be ideal for you. You'd be an ideal candidate for laser therapy. So again, this is for those more severe cases. Doesn't mean you can't do cold laser therapy on a non-severe case of costochondritis. It just speeds the healing time up, reduces the inflammation so much faster, 40 to 50% faster. And most people, by the time they come in here, they're desperate and they're already sort of at their wits' end. So oftentimes we jump right to the cold laser with people so we can speed up the results and get them relief as quick as possible. And cold lasers have been around for about 15, 20 years. They started in Europe. The Russians and the Israelis invented it. Started in Europe, and it's been used in Europe for years. It's only been FDA approved for carpal tunnel syndrome here in America as of maybe a year or 2 ago. And they just finally came out with a code for laser, like an insurance procedure code. So the insurance industry is slowly coming around. So guys, if you have any questions about costochondritis, about cold laser therapy or chiropractic and or physical therapy as it relates to costochondritis, please feel free to comment below. I guess right after we're done here, we're going to check his clavicle again, and then we're going to check see how he's doing overall. Where are you at now as far as when you first came in?
Definitely better. I think I took that step back when I was drinking too much. I think it's probably part of it, though. It's like I needed, my body in general just been telling me probably need to get some more sleep, relax, focus more on drinking fluids, water, stretching, doing stretches, having no stress.
So how much improvement have you had so far? Is it 50%, less, more?
I'd probably say at least 30-40%, especially
Okay.
from like my back perspective, because a lot of my original pain kind of came from the back area. I think the light therapy, along with some of the adjustments you've been doing in the back.
And now you have the lacrosse ball, right, to do the stretches.
Ball, yeah. And then I like the ice. Typically, I don't ice as much, but I've been icing a lot more since I've been out here.
Okay, yeah, ice the chest and heat on the back.
Has been, yeah, that's been probably one of my favorites as well.
Okay, you hear that, folks? So ice on the chest, heat on the back. It's had about 30 to 40% improvement in 5 days. It's not bad for 1 week of care. Obviously, in an ideal situation, we would see him over a course of 4 to 6 weeks. But that's pretty good for 5 days over the course of less than 1 week.
I think if I was, drinking water and being a little healthier, I think, and I was actually sleeping better too as well.
Like on your regular bed?
Like my regular bed and and how I like my bed and comfortable pillows and situation, everything situated, I'd probably be at like probably 55-60%, I bet.
Okay. Well, now you know there's hope. You can resolve this. So when you go back to Texas, continue the care that you're getting, with chiropractic care, and try to find somebody with cold laser therapy, okay? And we're going to laser this pec minor area and adjust his neck, and then we're going to check his clavicle here. And then send him back to Texas. And hopefully after this treatment here, you'll hit 50% improvement. And I'm happy with that in 1 week. We tell people to expect at least 50% improvement in symptoms in 4 to 5 weeks. So 1 week is good. I'm happy with that. I hope you are too. Okay, you can pull the shirt down. All right, let's have you stand up, face me.
Shirt off?
Well, I think we can. So you can see it's out again here, folks. Okay, so we're going to have to adjust that. Okay, let's have this side. This is the bad shoulder, so let's have this side facing down. So you're going to face that way. Sorry, you're not going to get to see this. Just envision it. I'm going to place my hand on his clavicle. Because it's superior, we're going to adjust it from medial to lateral and superior to inferior. And just relax here, buddy. Okay, it's not going to hurt. Okay, stand up and face us. All right. Okay, lay on your back. Slide up towards me. And make sure your chiropractor in Texas adjusts this clavicle, okay? Make sure he doesn't miss this. Look towards the right there, yep. And slide up a little more for me. Good. And turn to that side. I wonder how long you've had your shoulder like this, you know?
Yeah.
Okay, stand up, face me. Was that sore?
Yeah, it's sore.
Better, but still off. Lay on your back again. And slide up towards me. Turn your face that way. Okay, stand up. He has one of the most difficult clavicles I've had to adjust in a while. Okay, better. Not perfect, but definitely better. Okay, you're all set. It's been a pleasure treating you. All right, spin around. Cross your arms here. Tuck your chin down. Deep breath in. Hold on, I want to adjust that clavicle after I just did that, though. Slide up a little bit more for me. And turn that way. All right, you're all set.
Thank you.
You're welcome. And if you have any questions or comments, welcome. Thanks for tuning in, folks.